So, in terms of melanoma and treatment, if you're diagnosed with melanoma, the treatment is going to depend on those results. The results can tell us if there's a chance that the melanoma has even spread. So, we typically start out with instructions about surgery. We may have to have you back and remove more of the tissue around the melanoma site. We may consider immunotherapy, which is a treatment that may activate or suppress your immune system. An example of such a treatment may include targeted vaccines, or we may start out with other targeted therapies. Chemotherapy may be recommended, or even radiation therapy may be recommended. You will be cared for by a team of dermatologists and a group of oncologists who are specialists that specialize in diagnosing and treating cancer. We will likely share information in order to help you with your diagnosis. So, how can we protect ourselves from melanoma? There is no sure way to completely prevent melanoma. Multiple factors like your age, genetics, and family history cannot be changed. However, there are steps you can take to lower the risk of developing melanoma. As a dermatologist, I recommend the following sun protection advice. Limit your exposure to ultraviolet light during the middle of the day when ultraviolet light rays tend to be the most intense. If you have to be outdoors, seek shade as much as possible. Wear a broad spectrum sunscreen with an SPF between 30 and 50 every day, all year round. Wear sun protective clothing with sleeves and wide brimmed hats, which will protect the entire circumference of your face, including the sides of your neck and even the upper back area, depending upon how wide that brim is. Avoid weakening the immune system. There are several foods that can cause worsening of inflammation, like sugar, refined carbohydrates, alcohol, and even processed meat. When possible, eat foods that may help fight and reduce inflammation and strengthen your immune system, like berries, broccoli, fatty fish like salmon, avocados, even mushrooms.